Levin.
Thank you very much, Mr. Chairman. This is important legislation. Clearly, we all agree there's nothing more vital than the welfare of children. This committee has been working on legislation of this nature for many, many, many years. We have struggled to improve the programs to make them more effective and more accountable. And so we have here today a bill that is bipartisan and bicameral, as has been said, and I think we all join in congratulating Mr. Davis and Mr. Doggett for their leadership. And with that spirit, I would like to yield the balance of my time to the ranking member, Mr. Doggett.
Thank you, Mr. Levin, and my thanks to Chairman Camp and Chairman Davis. You know, the joy that my wife Libby and I feel each time we're home in Texas with our 3 young granddaughters makes it incomprehensible to us, as I think it does to most Americans, how anyone could abuse their child. But our daughter, who is a physician and heads a clinic for the uninsured, and her husband, a pediatrician there in Austin, have seen personally and told us about some of the tragic instances of abuse and neglect of our youngest Texans. Indeed, over 700,000 children across America each year are confronted with this ugly reality. One of the experts who testified before our subcommittee suggested that 1 child every 6 hours is reported to be killed by abuse and neglect in the United States. Each of these numbers, of course, represents a very precious little human being. The bipartisan bill that we have worked on in our committee extends and improves some of the policies that will help increase the ability of the states to respond to our at-risk children and respond to child abuse. But as we work together on this legislation, I think it's also important to recognize what we have not accomplished. Of the children that are found to be victims of abuse and neglect in America today, 40% never receive any kind of follow-up service or intervention. We have a foster care system that provides federal assistance, but it provides that assistance to less than half of the children in America who are in need of care due to the eligibility system that is woefully out of date. These challenges require much bigger responses in the future, and some of these responses come from assuring that the Social Services Block Grant remains strong, and it's troubling that they're impacted in a negative way by the discontinuation of the TANF supplemental grants. In fact, children are now more likely to be poor than in any other age group, and as our state and local governments cut their budgets, some of those who are most vulnerable get left out. The bill before us reauthorizes the Child Welfare Services and Promoting Safe and Stable Families programs for the next 5 years. It provides $700 million per year to fund child protective services. In my home state of Texas, this helps protect children in San Antonio through family-based safety services that strengthen and restore families, and in Travis County through programs that promote children affected by substance abuse. The Court Improvement Program works with the highest court in each state, and the regional partnership grants that are authorized are helpful in a variety of ways at the local level. I just received a contact this morning from my friend District Judge Darlene Byrne in Austin, who is one of the founders of the drug court there. And she says that the resources provided to families through the regional partnership grants that are authorized in this Act have transformed the lives and helped stop the cycle of drug abuse and violence that would not have been possible without this regional partnership grant program. The legislation also answers better supervision of, I hope it assures, but it answers the need to provide better supervision of children who are prescribed psychotropic medications to address their health care needs. This additional supervision will help ensure that these medications are only prescribed when they are necessary. The legislation improves the sharing of data. As the Chairman mentioned, this is very important. It's been a particular interest of Chairman Davis. Just as data sharing can detect individuals who should not receive benefits, it also can be used to improve outreach to Americans who are eligible for assistance but are not receiving it. Mr. Chairman, the future of our most vulnerable children depends upon our ability to work together to address the big challenges that remain in the child welfare system, and I look forward to continuing that effort with you, and I yield back.
I thank the gentleman for yielding back.